I'm here with Mayor Turner, our Harris County Public Health Director, Dr. Shah, Houston Local Health Authority, Dr. Persse, and Representative Wally, our recovery czar. Let me briefly just address the latest on the weather. We know that as Hannah tracks west tonight, we'll be expecting some rain chances, the threat of heavy rain, but we don't expect it to be severe. Of course, we must continue watching this. And it's a good reminder that we're in the middle of hurricane season, that we're vulnerable to these storms, and so we continue to ask everybody to make sure they have a plan, that they have a kit, and that they purchase flood insurance if they can. Remember, it takes 30 days to take effect. All that information is on readyharris.org, and we are watching the weather, these systems as they continue to track our way to make sure that we keep folks safe. Today, we are announcing 552 cases in Harris County outside the city of Houston and 5 deaths. Yesterday, our region reached another grim milestone. We crossed 60,000 cases across both Harris County and the city of Houston total. The good news is we've seen slight declines in hospitalizations, ICU and general population. They're very small, they're very slow, but they're there. The bad news is we've been seeing a huge increase in cases. Just in the past few weeks, we've continued to break records with the number of daily cases. The deaths these past few days, very high, but the 7-day average of cases is very high. It's 100 cases per day higher than it was on July 13th, for example, where we also have tens of thousands of active cases in the community. And that is all still a raging wildfire. We don't know what all of those cases are going to mean for future hospitalizations, and we have to keep watching. Over the last few weeks, I've heard from parents and teachers at a loss about what to do with school starting so soon. I've spoken to almost all the superintendents in Harris County. I've spoken with teachers and with parents and have heard a need for uniformity and a need for public health guidance. These superintendents have explained to me that they are educators, not medical doctors. With that in mind, our health department today, Dr. Shah, along with the City of Houston's Health Authority, Dr. Persse, will issue an order requiring all public and non-religious private schools in Harris County remain closed to in-person instruction until at least September 8th. Now, that does not mean they can't start online instruction earlier, but I know a lot of the schools are moving their calendars. Let me be clear. This is at least until September 8th. More likely than not, September 8th is too soon, but we're going to aim for it. We'd love to meet that goal. It's very likely, though, that if trends continue as slow as they are, if cases continue to rise and that gives way to hospitalizations increasing, that we may not meet it. We will reassess this in the next few weeks. We'll be working on benchmarks and on thresholds based on best practices, based on what's worked in other places and other jurisdictions, not on what we wish would work. The start of on-campus instruction and activity may be delayed further based on those thresholds and based on monitoring of the metrics that we see. So the idea is to give some clarity, to give some consistency, but really we need to work on thresholds and not on dates. I owe everything in my life to public schools. When I showed up to an amazing public school, that showed me what government could do. My counselors and my teachers set me on the path that I am here today. The last thing I want to do is shut down a brick and mortar representation of the American dream. But right now, we're guided by human life, which has been our North Star, and we have to make tough decisions. The most important point to get across today is that we, each of us in this community, have the power to bring these kids back to school. That's squarely in our hands. What I've been asking for folks to stay home is what we need to do to bring the kids back to school sooner. The reason other communities have been able to start school, yes, they also had Memorial Day, and they also had protests, just as we did. But they brought down their curve back in April and in May. They didn't give up early. We can't afford to give up early again. So let's continue working until we crush that curve. We bring this under control. We bring down that community spread. And then we can responsibly bring our kids back to in-person schooling. I'm not going to raise false hopes. In part, that's what's got us to where we are in this moment, tragically. Even if we do meet benchmarks that tell us it's safe to resume in-person instruction, it's not going to be all students back all at once. We're going to have to work on processes. That may mean some students go for a few days. It may mean some populations go in first. We have to work with the reality of the situation, not false hopes, not what we hope will take place. I want to thank all the school districts who've taken action already to delay in-person instruction. Right now, we continue to see severe and uncontrolled spread of the virus, and it would be self-defeating to reopen schools as usual for in-person instruction. Almost 1 million students from grades K through 12 in Harris County. We are all desperate to move on from this crisis. But I want to remind everybody, the faster we work together, the faster we bring this virus under control, and that means crushing the curve. It does not mean flattening it at an extremely high level where our ICUs are still crossing into surge capacity, where we have tens of thousands of active cases. It means bringing down those numbers. The faster we do that, the sooner we'll be in a position to reopen again for the long term. And I hope that the religiously affiliated schools will follow suit to help us bring that curve down faster and ensure that our kids can go to school in person where they belong and where they deserve to be. Our children's education and their ability to succeed, to continue thriving, is in our hands and has been in our hands. So it's time for us to work together and get this under control. Thank you so much. I will give the podium to Mayor Turner, and then we'll hear from Dr. Shah, Dr. Persse, Representative Wally, and then I'll repeat my remarks in Spanish. Mayor Turner, thank you. Excuse me.
Thanks, Judge. Thanks, Judge, and I certainly want to thank you for your leadership. And State Representative Amanda Wally, good to be with him, the Chief Recovery Officer for the Harris County, Dr. Persse, Dr. Shah. It's good to be with all of you. Over the past several days, my office has received phone calls and emails from parents and teachers, and I have consulted with superintendents about opening schools during the current public health crisis. Houston Independent School District is the state's largest school district with 288 schools, 13,000 teachers, and more than 210,000 students. My office worked with a total of 17 school districts within the city of Houston, and we also collaborate with Region 4, which includes 48 districts. Let me just say that the COVID-19 positivity rate and hospitalizations are at an unacceptable level. We should not be very careful about sending our children, teachers, and staff back for in-person instruction when the virus is still spreading uncontrollably within our community. Yesterday, for example, the city of Houston Health Department reported 919 cases and 11 deaths. And overall, 357 people have died in the city of Houston, including some who were in their 20s and 30s and 50s with no underlying health conditions. The virus in the city of Houston, Harris County, is not under control and is spreading rampantly still within our city. I want to give some context to what we are saying today and why the action is being taken. If we go back, for example, in the city of Houston alone, In March, the total number of positive cases was 377. In May, that number was 3,793. In June, that number, and for the month of June, was 12,885. And as of today, and we have new numbers that will be coming out later on this afternoon, but as of today, in the month of July, that number is 19,139. So when you look at each month, coming from March to where we are, the number of positivity cases just inside the city of Houston has exponentially increased. And it has really taken off since we opened up our economy. And so for June and July, these numbers reflect an uncontrolled virus taking place in the city of Houston. With regards to the number of deaths within our city, in March, for the entire month of March, that number was 4. In April, the number was 52. In May, the total number of deaths went up to 73. In June, the number was 95. And as of now, in July, just for the month of July, the total number of deaths in our city is 133. And so as you can see, the number of deaths every month is exponentially rising. In that context, it is very difficult to talk about returning our kids to school in the month of August. We all have a stake in this process. Education is vitally important. The pandemic disrupted our normal routines when schools closed early and districts shifted to online learning. We do not want children to fall behind. No one wants our kids to fall behind. We want students at all levels to get the knowledge and skills they need to succeed. And in some cases, we also know they miss seeing their friends and teachers in person. But we must keep them safe, our teachers safe, janitors, bus drivers, cafeteria workers, and so many, many others. And that is why it is important that we move based on the science, the facts, what's happening on the ground, and we do it in a very measured and methodical fashion. Saving lives and slowing the virus from spreading are the city of Houston's top priority. And we can do that by delaying in-person, face-to-face instruction at a minimum until September the 8th. We are at a critical moment in the fight against COVID-19, and we must take a step back and work to lower the positivity rate and hospitalizations. I want to echo something that the judge said. The positivity rate within the city of Houston and Harris County varies anywhere between, let's say, 20, 22, sometimes 23%. And even though there is some modest, minor decrease in terms of the number of people going to our hospitals, and even though it appears, even in our ICU capacity, there's been some degree of slowing down, it is happening at a very high level, much higher than existed in April and May. And in order for us to have some degree of confidence and for our testing and contact tracing program to be effective, that positivity rate must be driven down. Not to 20%, not to 15%, not 10%, but quite frankly, it needs to be much lower than that. In New York, it's 5% or below. In Boston, it's below 5%. And that is why they're able to move forward in a very measured way with the greatest degree of safety for all concerned. In a few weeks, we can look again at the data and see where things are and reassess. But I want to make it very, very clear. Even, for example, if the governor in the state does not return a stay-home order, it is important for the people within our city and the people within our region to assume and take the responsibility to do the things that we know work. And what we do know about this virus is that it feeds on one another. It feeds on close contact, socialization, group gatherings. It feeds on that. And in order for us to be successful, We have to take the energy and the fuel away from this virus. And the quicker we do that, the quicker we're going to be able to take those steps to move forward. Now, quite frankly, and I'll leave it to Dr. Persse and Dr. Shah and to our medical community, quite frankly, I don't know if just wearing a mask and engaging in social distancing and the proper hygiene is going to be enough to lower that positivity rate in time to do the things that we need to do. Now, yes, we are, in a sense, plateauing at a very high level. But the question is, just with the tools that we are employing today, how soon will it be for those tools that we are just employing today to bring that positivity rate down to where people will feel comfortable and where our contact tracing and testing protocols will be most efficient and most impactful? So let me just say, our kids are our greatest assets. And the teachers and the cafeteria workers and the bus drivers and the janitors, these are vital, essential people who are needed to service our kids. And I think it's very important for us to do everything we can to put them in the safest environment in order to make sure that we are not using them in this experiment. Thank you. Dr. Shah.
Thank you, Mayor. Thank you, Judge. Mayor, Judge, for your continued leadership. I want to also thank Representative Wally as well as Dr. Persse, my colleague here. My name is Dr. Umair Shah. I'm the Executive Director and Local Health Authority for Harris County. And I want to really echo what you have just heard. We know that kids are precious to all of us. And our school-age kids particularly are going through a very difficult time right now. We know that time is really because a lot of them are essentially staying home. And they're not seeing life like all of us as adults have seen. All of us have been impacted, yet we remember our childhood, and our childhood is not what our kids are seeing now. And I'm saying this not just as a local health authority, as a physician, I'm saying this as a father. Father of 3 children, 2 that are school-age children. And I'm telling you that every single day, my wife and I are having this discussion about what's happening with our children. What are we going to do? What's going to happen? And how is this pandemic affecting them? And I know there are so many parents out there that are having the same discussions every morning, every afternoon, every evening, every night. They're having it with themselves. They're having it with their neighbors. They're having it with their school, whether it's the superintendents, teachers, faculty. They're having it with everyone involved, but most importantly, they're having those discussions with their kids. And I think we have to remember, and the judge and the mayor just said this, and I want to echo, when you have transmission that is high in our community, it's uncontrolled in our community for COVID-19, and you're seeing increases in cases and also deaths that are occurring, this is not the time that we take the 900,000 plus students in Harris County and say, go back to school in person because it's okay, because it's safe. It is not safe. And that is the reason that Dr. Persse and I are signing this local health authority order today, because we want to make sure to emphasize that it's not just about protecting our children because they are the most precious resource for us, but it's also remembering that those very children are dependent on all of us as adults, as parents, as community members, to make sure that we do the right things, we model those behaviors that are going to allow them to have the same experiences that all of us had when we were children by being able to go back to school in person. This is going to be a difficult process. You've just heard about the numbers. You've heard about the positivity rate. You've heard about the concerns. What you haven't heard is that all of us continue to recognize that we want just as much as everybody to have our kids back in school in person as quickly as possible. But it's just not safe to do so right now. So I wanted to also mention that with the positivity rate and with the increase in cases throughout the community, I want the community to remember This is with 900,000 children, students that are not at school. If you can put it in perspective, all this time that we've been doing all of these activities and actions and taking all the steps that we've taken, what could or would that positivity rate been, or what could or would the number of cases been, or what could or would the hospitalization numbers be if almost 1 million kids were actually not home but in schools? And that is another reason that we are very concerned about what's happening. I want to thank our schools. I want to echo what Judge and Mayor just said. Our schools, our superintendents, our teachers, our parents, we have received so much feedback. We have met virtually with so many, and we have heard you. We know that this is important. This is one of the most important decisions that all of us are challenged by in the midst of this pandemic. But it is not safe now for us to have our children to go back to school. Let me shift for just a moment to the medical perspective. I know the judge mentioned this and the mayor echoed this as well, that while September 8th is the date that we have put in the health authority order, it was a very careful, deliberative process in getting there. And the judge and the mayor said it very nicely, and I just want to repeat this, that we, Dr. Persse, myself, our respective teams, along with our county and city leadership, we're going to continue to watch all those indicators, all those measures. And it's not just one indicator, it's not just one measure, it's everything together. We're going to watch those over the next several weeks. And again, it's up to all of us as adults to help make this a situation where our kids can come back sooner to in-person instruction. We've also heard that people say, well, children don't get COVID-19. We also hear that children don't have severe disease from COVID-19. And we also hear that children, some say, may not be able to spread COVID-19 as readily. And that's not true. Kids can get COVID-19. Kids can have worsening conditions. In fact, there is a condition called Multi-Inflammatory Syndrome that is a very concerning condition. We've had cases, 186 cases across the U.S. We've had a handful of cases here in our community. In addition to that, we also know that kids can spread COVID-19 even if they have mild symptoms or no symptoms. They can spread it to their teachers, they can spread it to other people at the school, and they can certainly come home and spread it to their parents, their grandparents, and those with underlying health conditions. That's why it's so important for us to remember that kids also can be affected by COVID-19. Let me also say that every community is going to have a different set of challenges. And so I would caution us not to look across the country or across the state and say, what are other communities doing and why are we doing this way? We have to remember that we are making the best decisions from a public health standpoint here in our community. And we are completely 100% focused on making sure that our community is safe, healthy, and ultimately protected. Let me close by saying, if we want our schools to reopen quicker in person, it's going to take all of us to pull together in order to be able to do that. Thank you, and I'm looking forward to some additional questions. Dr. Persse.
Thank you, Mayor, Judge Hidalgo, Dr. Shah, Representative Wally. So Dr. Shah has said pretty much everything. I just want to put in context to keep in mind something he touched on, and it's, while we focus a lot on the children and the students, and we talk about the faculty and the staff at the schools being at risk, let us not forget the families that the children will bring the virus home to, and their elder family members, right? So anecdotally, so today I'm the physician on call for the Houston Fire Department. I have somebody covering my call right now. We do this press conference. But this morning between 7 and 9 a.m., I helped manage 2 cardiac arrests, 2 CPR cases. In both of those cases, the people had been recently diagnosed with COVID disease, and I don't expect that either of those, unfortunately, were going to survive. The firefighters and the paramedics did everything they could, but as they were going to the hospital, the outlook was pretty dismal at that point. Both those people were awake at some point this morning and collapsed at home with their families. In the second case, the report that I got was that every member of the family in that household had been recently diagnosed with COVID disease. So the last thing that we want to do, and we all know, now my daughter is no longer at home. She's just grown and out of the house, but I clearly remember what would happen because I'm a bit of a rhinovirus magnet. So every year I would get the cold. In fact, I routinely get the cold twice a year. It's just the way I'm put together. But I knew that once school started, that I needed to beef up my hand washing and be careful what I touch, and invariably that failed. And I would catch a cold, and I get it twice a year. I get one shortly after school would start, and I get another one generally in January or February. And it's not the kids' fault. This is what kids do. They go to school, they hang out with their friends, they laugh, they talk loud, they do all the things that the virus takes advantage of to spread. And the kids, thank God, don't get terribly sick for the most part. Some will, and as Dr. Shah points out, the denominator we're talking about is a huge number. And so even a tiny percentage of a huge number is still a big number. And if they then bring the virus home, well, first of all, a small person, a big number is still a big number. So if those kids, if we get a big number of kids who get seriously ill, I think we need to recognize that is all preventable. Is all preventable. And for those kids who bring it home and spread to their family members, those infections are preventable as well. So when I say that, I don't want us to focus too much on just what we're doing with the schools, is the prevention. The closing the schools really is a strategy to buy us yet even more time for us as a community to get the virus under control. So if we want the schools to start opening up again on September the 8th, we as a community have between now and then to get the numbers down. And while some of the numbers that we're hearing from some of the folks in the medical community might be a little bit encouraging, please do not overinterpret what that means. I've been using the analogy, and I particularly use the analogy, this is a school bus because we're talking about schools. So this school bus right now is no longer accelerating, or it appears at least to not be accelerating. Maybe it's not accelerating, and maybe it is and in fact I'm sure that it is in certain parts of the community. It is still accelerating because we're still getting really high new case numbers. So depending on how you look at it, you may think it's not accelerating, maybe not. But either way, it doesn't matter because this school bus is going 100 miles an hour. And we've got a curve ahead. So as a community, we have got to slow this down, and we've got to slow it down a lot. So at some point in the future here, I think the numbers will start looking better. And we will really have confidence that the numbers really are starting to look better. That should happen in the coming weeks if we all do our part. But once that begins to happen, that is not the time to stop our efforts. So if you look back in March and April, we had some very low numbers. Now, let's remember that there was a statewide lockdown at that point, and that's what it took. We don't have that lockdown anymore, which means that as individuals, we've got to redouble our efforts to make sure we're wearing masks. If you see somebody not wearing a mask, don't go near them. And if you know them well enough, you may want to ask them to put on a mask. And if you know people that are having a gathering, a social gathering, you may want to ask them not to do that. Because those are the types of behaviors that the virus takes advantage of. And as long as the virus is spreading through our community, we're at risk. The kids are at risk. The economy is at risk. We have control over this. We have limited options, as the mayor points out. We only have limited options right now. So that means we have to maximize those tools in order to be successful. Thank you. Representative Wong.
Thank you, Judge Hidalgo, Dr. Shah, Mayor Turner, Dr. Persse. Look, I stand here as obviously a member of the Texas legislature, having to deal with schools on a yearly and almost daily basis, but also as a father of school-age children. One is Armandito, he is 10 years old, and Joaquin is 6 years old. They're both about to enter first and fourth grade. And believe me, I understand the anxiety that parents have in trying to plan a safe way to transition into school. So I'm here as a parent as well. I'm also here as somebody who grew up with their grandparents, Dr. Persse, to a single mom living with both my grandparents. And so, and I know my story is emblematic of many stories in our communities where we live in multi-generational families in one household, where you have grandparents, you have parents, and you have children, and sometimes extended family that live with you in the same household. So this measure is a measured approach, is a measure that is well thought out so that we don't have this community spread. Now look, we all want children to go back to school as fast as they can. Believe me, I want my children to go back to school as fast as anybody else wants them to do as well. But at this point, knowing what we know at this point, it's probably not safe to do that at this point. Lastly, TEA about a week ago announced that they were going to propose $200 million in digital divide devices. I would say to Commissioner Murad, to the state leadership, thank you. We appreciate those resources. It's not enough. We need more resources, more investment from the state to provide devices and connectivity, because you have many, many, many children in this community that are going to be left out with maybe no device, or have one device but not have connectivity, or vice versa. If you do have a device and you do have connectivity, you have multiple children in that household. So I would say my parting point would be that we need more investment from the state to provide devices and connectivity for children that do not have access to the devices and activity to do the virtual learning that we're asking them to do up until September 8th. So again, thank you for that investment. We hope that that's a down payment because we have probably over close to $500 to $600 million. Digital divide costs money. There's probably $500 to $600 million in need, Mayor, Judge, in bridging that digital divide for many, many children. Many children. And many of those children are low-income children in our communities. So I'm talking to those parents. I'm imploring those parents to reach out to our state leadership to make sure that we put pressure on our state leadership to put more investment into bridging this digital divide, because the resources are there. The state has resources, has CARES Act money as we speak. And so I implore them, thank you for the first $200 million. We need another $200 or $300 more million to bridge that digital divide for these children that will be virtual up until September 8th, which is the recommendation. Thank you, Judge. Thank you, Dr. Shah. Thank you, Mayor. Dr. Persse.
Thank you so much, Representative Wally. Let me just briefly repeat the remarks in Spanish and then we'll take questions. El día de hoy sabemos que viene la tormenta tropical Hannah. Está la opción, o sabemos que nos va a afectar más tarde esta noche. No esperamos sea muy severa, pero esto nos recuerda que es la temporada de huracanes. Entonces debemos trabajar por planear, tener un kit, tener un plan. Si pueden obtener seguro contra inundaciones, todo eso lo pueden obtener a través de readyharris.org. Somos una región vulnerable a estas lluvias, a estas tormentas tropicales, y necesitamos estar preparados. Nosotros seguimos observando todos estos movimientos del clima para proteger a la comunidad. El día de hoy estamos reportando 552 casos y 5 muertes en el condado Harris fuera de la ciudad de Houston. El día de ayer alcanzamos otro nivel grave. El número de casos de COVID en la comunidad ya pasó los 60,000 en el condado Harris, incluyendo la ciudad. Las muertes que hemos visto estos últimos días, relativamente altas, el número de personas que están falleciendo por el virus. Las buenas noticias es que hemos visto una pequeña caída de número de hospitalizaciones, tanto en la población general como en las unidades de cuidados intensivos. Este número está cayendo de una manera muy lenta, es bastante pequeño el cambio. Entonces, pues hay que notar eso, pero sí existe. Las malas noticias es que seguimos viendo un incremento bastante grande en los casos. En las últimas semanas hemos estado rompiendo récord tras récord en los casos diariamente. El promedio de casos en los últimos 7 días en el condado Harris es 100 casos más altos de lo que era el 13 de julio. Continúa siendo un reto. Esos números sumados a los decenas de miles de casos en la comunidad activos en este momento, reflejan realmente un incendio sin control. No sabemos qué significa esos números para las hospitalizaciones del futuro. En las últimas semanas he estado escuchando de padres, de maestros, muy confundidos, preocupados en cuanto a qué hacer con las escuelas, empezando tan pronto. He hablado con casi todos los superintendentes del condado Harris. He hablado con maestros y con padres. He escuchado la necesidad de consistencia, la necesidad de guías basadas en salud pública, en ciencia, en medicina. Estos superintendentes me han explicado que ellos son educadores, son maestros, no son doctores médicos. Con eso en mente, el Departamento de Salud del Condado Harris hoy, con el Departamento de Salud de la ciudad de Houston, estarán emitiendo una orden requiriendo que las escuelas públicas y las escuelas privadas no religiosas pospongan la instrucción en persona hasta al menos el 8 de septiembre. Para ser claros, es hasta el mínimo 8 de septiembre. Puede que el 8 de septiembre sea demasiado pronto. Puede que no lo sea. Vamos a intentar tener esa como una meta. Nos encantaría alcanzar esa meta. Pero es muy probable que si seguimos viendo los números que hemos estado viendo, este número de casos, estas tendencias en los datos, que no vamos a estar listos para ese entonces. Ahora, la instrucción vía internet, la instrucción a distancia puede suceder antes del 8 de septiembre, pero en persona tiene que ser mínimo ese día. Vamos a reevaluar en unas cuantas semanas, vamos a estar trabajando en niveles, vamos a estar trabajando en puntos de referencia para decir cuando se bajen las hospitalizaciones a tal nivel, tener tal información, en ese momento sí vamos a poder ofrecer, permitir la instrucción en persona. También entonces hay que tener en mente que podía ser aún más tarde. Todo lo que he alcanzado en mi vida hasta ahora se lo debo a nuestras escuelas públicas. Cuando llegué a una escuela pública increíble, vi lo que podía lograr hacer un gobierno por la comunidad. Mis consejeros, mis maestros me pusieron en el camino para que llegara a donde estoy hoy día. Lo último que quiero hacer es cerrar una reflexión física del sueño americano. Pero en ese momento tenemos que guiarnos por la importancia de las vidas humanas. Eso siempre ha sido nuestro centro durante esta pandemia y hay que tomar estas decisiones difíciles. Lo más importante que quiero que todos reconozcamos es que está en nuestras manos el que los niños puedan regresar a las escuelas. Lo que he estado pidiendo, que todos por favor se queden en casa, salvo actividades esenciales, es lo que tenemos que hacer para que los niños regresen. Muchas comunidades, varias comunidades a lo largo de nuestro país, están pudiendo reabrir las escuelas en persona. Ellos también tuvieron el Memorial Day, también vieron protestas, pero antes de eso habían bajado la curva de hospitalizaciones. No se dieron por vencidos temprano, como sucedió en este estado. Trabajaron por bajar las hospitalizaciones, por bajar los casos severamente y en ese momento reabrir de una manera responsable. Entonces tenemos que hacer eso aquí, tenemos que trabajar juntos. Tampoco quiero presentar falsas esperanzas. Cuando logremos bajar esa tasa de hospitalizaciones, controlar este virus, aunque logremos llegar a esos puntos de referencia, no vamos a reabrir la instrucción en persona al 100% todo de una. Puede ser que ciertas poblaciones más vulnerables, ciertos niños que necesiten más atención, sean los primeros en regresar. Puede ser que haya que alternar los días. Hay que ver lo que han hecho en otras comunidades a través del país, a través del mundo, ver qué ha funcionado y basado en eso, tener un plan, una estrategia. Esas falsas esperanzas, ese deseo de que las cosas sucedan solo como las queremos, no como es la realidad, es en parte lo que nos ha traído a donde estamos hoy día. Entonces quiero darle las gracias a los distritos escolares que han tomado acción ya para posponer la instrucción en persona. Le pido a las escuelas privadas religiosas que también sigan esta guía. El requerimiento no es para ellos por guía del Estado, pero todos los demás, tanto privadas como los distritos escolares dentro del condado, porque tenemos que controlar esa curva. Hay casi 1 millón de estudiantes dentro del condado Harris, de kinder al grado 12. Son muchos niños, muchos contactos que sucederían en las escuelas, transmisión que se llevaría a la casa, a los padres, a los abuelos, a las familias, a los trabajadores, conductores de autobús, administradores, profesores, maestros. Entonces, trabajemos juntos. Esto está completamente en nuestras manos. Si logramos quedarnos en casa, evitar contactos, utilizar la mascarilla, bajará esa curva más rápidamente. Es la única solución. Y seguiremos trabajando por apoyar a la comunidad con nuestras intervenciones de salud pública. Muchas gracias. Okay, we will now take questions.
Chelsea Edwards, Fox 26. For Judge Hidalgo and Mayor, are there any plans to work with the district to help offer additional support for parents during this time, especially since a lot of them in low-income families have been struggling with kids staying at home and all the stay-at-home orders?
Yeah, this is incredibly difficult for children. A lot of kids, really the best place for them to be is school. We just can't have any kind of gathering right now. So some of what we've been doing, of course, supporting efforts to feed those families. And we're going to continue working with the schools, with the food bank, with the region to support as much as we can those efforts. The digital divide issue, very important. We hope the state is going to offer the support, the financial support that we need. But I can commit to you in Harris County, we're going to do everything in our power to make sure, regardless of what the state does, to make sure that every child who needs a device, who needs connectivity, can get it. And so we're working to make that a reality, whatever we have to do. Now, that's still not perfect. There are some children who, parents have to work. It's hard for them to focus. They're too small. They can't sit in front of a computer. And that's why really the solution is for the entire community to work together, to bring that curve down, to put us in a place where we can at least, the children that most need in-person instruction, begin to send them back. But right now, we can't have any kind of gathering, much less tens of thousands or hundreds of thousands of students throughout our community. And we'll continue that coordination. I think part of what's important and that I've learned from these conversations with the superintendents is having that health authority guidance. And so as we work to look at thresholds, as we work to figure out what it was that's worked in other communities, what a phased approach might look like, is having that communication so that we can really offer them guidance. And part of the reason we're doing this is to make clear our local health authorities are ready to step in, are ready to support, provide that medical guidance that nobody can expect these teachers, these administrators who are experts when it comes to education, that they will also have an expertise in health and public health guidance.
And I agree and come in agreement with everything that the judge said on that. I will also, and I want to piggyback what State Representative Armando said. The state has provided $200 million for devices, but the state has received well over $1 billion in CARES money for connectivity and devices. So that should only be viewed as a down payment because in the era of pandemic, connectivity, Wi-Fi spots, devices are critically important so that many of the kids in these low-income communities are not left further behind. So that's a critical piece. And I, too, would urge the state to do even more and to commit more now for connectivity and for devices. Secondly, every year, it's my mayor's back-to-school program where we provide backpack supplies and other services for about 25,000 kids. That will continue. So on August 7th and 8th at NRG in the stadium, in the parking lot, will be the food, mask, a backpack, and supply distribution, 2 days, all day. And this is for kids through K through the 5th grade. And so that will be made available. But we're expanding that for food distributions as well as for masks and other supplies. So that's major. We recognize that there are food insecurities. And so for many of our kids, they go to school to get the breakfast, the lunch, those type of things. And we'll work very closely with all of our school districts to make sure that their nutritional needs are met. So we don't want that stopped. At the same time, we recognize that there are some kids that are homeless that also come from the homeless population to schools, and we want to extend our outreach to make sure that they are not left behind, that they get the support and the assistance that they need. This is one of those times when the community will have to wrap their arms around all of these kids and their families, even more so. And I established the Health Equity Response Task Force, HERS. It was scheduled for tomorrow to have a major drive for these vulnerable at-risk communities. That's been rescheduled because of the weather, but that will take place in the month of August. So there are a number of things that are taking place. I would also encourage Congress, as they are now debating the next stimulus package, to provide rental assistance and mortgage assistance, because these children come from families, and these families are needing to make sure that they have the rental assistance or mortgage assistance. And so even as they talk about providing additional funding for schools, it's not just about schools. These kids come from homes where their families are struggling, and they need that rental and mortgage assistance, and I would hope that they would provide assistance on that front. Thanks, Judge.
This next question comes from KTRK for Drs. Persse and Shah. Looking at testing sites across the city and county, most city and county-run sites are open only during work hours, which can be a problem for working people, especially in Black and Hispanic communities. It's not a new problem, but how much does that concern you, and have you considered opening more after-hours testing locations?
Dr. Shah. Yeah.
Thank you for asking that question. Actually, it reminds me of another important thing that Dr. Persse and I spoke about, but we failed to mention, which is we have some very not so good weather coming our way over the next few days and into next week, and our testing sites may have some impact on their ability to provide services. The hours may need to be shortened or changed or revised. So we want to make sure our community, if you do get an appointment to go to one of our testing sites, that you also make sure you check before you go. Even if it's a day later that you've got the appointment, check before you go so you don't get there and because of the weather something has changed. Your question is a really good one. This has actually been something that we have discussed internally quite a bit. We originally had our hours that were different than they are now. Unfortunately, because of the summer heat, we've had some challenges where we've had to actually shift our hours to the morning hours. We were looking at what we could do in the evening hours, so we could do essentially a split shift. But because of the way we were working with our FEMA partners, some of the challenges with the way pickup was done and all sorts of other shipping, because samples had to be shipped that night, we were unable to do that. We're all looking at this as we get past this extension that FEMA has given us through July 31st of what that could potentially look like. Some of the options are even looking at locations that are more indoors or have some more shading or the ability to be able to handle things during the day, but also if we need to shift those hours to the evening. Certainly we're providing hours early in the morning, so that people hopefully before they go to work can get tested. We recognize this is a big issue. On the weekends, obviously on Saturdays we're open as well, but we have not fully addressed this in the way that we feel that it should handle what is happening in our community and the concerns. So we're going to continue to look at this, but I tell you that this is something that we have been discussing internally because it is an important piece for us to make sure we get this right. Dr. Persse, if you want to add to that.
Yeah, so the situation of the city in terms of the constraints for the hours, it really, as Dr. Shah pointed out, it revolves a lot about when we have to have the samples to ship to the lab to get the test done. And so for our sites, the latest possible pickup is at 5 p.m. Otherwise, we have to hold them overnight. Now, the problem with holding them overnight is that every time you do that, you run the risk of degradation of the samples. And so in order to get the most accurate samples, you've got to get them to the lab quickly. And as you know, with a lot of our samples are going to local labs, we're getting the turnaround very quick. We're getting them in generally about 48 hours. The samples that go off to the national labs, that's where we're having the long delay. So in those situations in particular, we don't want to add in more delay. The other thing to remind folks is that our large testing sites, which are at the 2 stadium sites, ironically, in spite of how much viral activity is, that the numbers of people going to those are down now. So for the folks who are working, hopefully they're not working 7 days a week, and they can find at least 1 day of the week where they can go. And so if they call and they get their number, there shouldn't be as long a wait as there may have been in the past when we were maxing out, because tragically we're not maxing out anymore. So there is capacity pretty much every day of the week. So I offer the day that you're not working, you should be able to get tested.
Judge Hidalgo will need this answer in both English and Spanish. So as we watch Hannah, in the event of major flooding, what's the response going to look like? What are the plans for shelters and, in the middle of this pandemic? And will there be social distancing, and who will be allowed in those shelters?
Yeah, we wish that the hurricane season would take a break because we're facing a pandemic. But of course it won't, and we're reminded of this by this tropical storm headed our way. We have been working very closely with the Red Cross, who are the ones that usually run these sheltering operations, and they have exercised their revised plans with COVID in mind to say, okay, if we can find spaces, if the impact is small enough that we can house people in hotel rooms, we will do that. If it's larger to where we can't sustain that, how can we begin building dividers, enough separation to where if we would have to shelter, that there would be minimal risk to the virus. The situation is not ideal. It really isn't. And so the good news is we have those secondary plans, and because we're all activated right now to address this virus, all of our partners are already in constant communication. We've reviewed our plans, and it would be just a matter of shifting our sights for a minute from the virus to whatever weather comes our way. The most important point right now is just really to remind folks about flood insurance. I know a lot of folks may not be in a position right now to afford it. For folks who can, every time there is a flood, we see, we jump in to try and offer the support that we can. Sometimes we qualify for federal aid that can go directly to individuals. But folks can never be made whole unless they have flood insurance. It's a huge difference, the communities, the families that do and the families that don't. And so even if you've never flooded before, we live 50 feet above sea level. And while we're working on our flood control projects as quickly as we can't do it any faster. They won't all be done for a few years, and we're going to need more after that. And so we're still vulnerable, and we need folks to do that and to watch out for themselves and for their families by keeping track of the news, making sure they have a kit, making sure they have a plan for evacuation, and having flood insurance if they can afford it. En español, estamos viendo la tormenta tropical y obviamente nos recuerda que es temporada de huracanes. En cuanto a refugios, si hubiera necesidad de ofrecerle albergue a la comunidad, a personas que hayan perdido sus hogares, tenemos ya parámetros que hemos trabajado con la Cruz Roja. Ellos han diseñado nuevos procedimientos, nuevas estrategias ahora que estamos enfrentando esta pandemia. Entonces la idea es, si el número de personas afectadas es suficientemente bajo, tal vez ofrecerles cuartos de hotel, sino tener diseños donde haya divisiones, donde haya suficiente distancia entre familias para minimizar lo más posible la posibilidad de transmisión del virus. No es ideal, pero es lo mejor que hemos podido diseñar. Estamos trabajando, lo bueno es que todos estos socios, todas estas agencias de respuesta, de ayuda a la comunidad, todos estamos trabajando juntos ya por esto de la pandemia. Entonces, en cualquier momento es simplemente reorientar si hubiera una lluvia, un huracán, una tormenta tropical, pero lo que pueden hacer las familias en este momento, aquellas que tienen los fondos, obtener seguro contra inundaciones. Es muy importante cuando las casas, los hogares se inundan, aquellas familias que no tienen seguro contra inundaciones no reciben la ayuda necesaria. Podemos ofrecer nosotros lo más que hay, pero es imposible ayudarles al 100%. En cambio, las personas que sí tienen seguro rápidamente reciben los fondos y se recuperan. Entonces, todos, aunque no se hayan inundado previamente, aunque su área no se inunde, no se confíen. Vivimos a unos cuantos metros del nivel del mar y además estos proyectos de control de inundaciones, aunque los estamos trabajando muy rápidamente, todavía faltan años para que se completen. Entonces, estamos todavía muy vulnerables a las lluvias, al clima. Entonces, por favor, recuerden el seguro contra inundaciones si pueden y de cualquier manera tener un plan de evacuación, tener un kit en casa. Todo eso está en readyharris.org.
There's also the question of who might be allowed in the shelters. Is there any kind of testing process? And if someone is upfront about having tested positive but needs to go to a shelter, is there a plan in place for that?
Yes, of course. Even, right now we have plans where we support first responders who have tested positive and don't want to go home and infect their families, who are, have symptoms, probably have the virus. So it's something similar. There are procedures for if folks have the virus, they would have to be in a certain place. If they have symptoms, they'll probably be in a different place. If they don't have symptoms, don't show high temperatures, don't show that they may have it, it'd be in a different area. So all of those processes, all of that has been integrated into the plans. And that's in the design, and it's been rehearsed. So we're as prepared as we can be. But, if we face a very, very strong rain, of course, that's always a strain. So the best preparation right now is, we're going to keep watching, we're going to keep running these plans, and then for the community to just stay alert and try and have that flood insurance if they can.
Sorry, we need that one in Spanish too.
Ok. Tenemos también procedimientos si hay una persona que tenga el virus, habría otra área para que ellos, refugio para esas personas con síntomas y pues obvio separado de donde se encontrarían aquellas personas sin síntomas, sin temperatura. Todo eso está en los planes, estamos tan preparados como podemos estar para ofrecer albergue, pero obviamente es un reto en estos tiempos.
Oh, goodness. Mayor, can I get you back then?
Yes, can I help you?
Okay. The president of the Firefighters Union tweeted that you cut services at 6 fire stations. What's your
I don't mind answering that.
Okay.
Let's not deal with misinformation.
Okay.
Okay? The Chief Pena has responded to that so many times. That is not true. And I would appreciate if the media would not continue to even allow anybody to put forth misinformation. No services to the fire departments have been cut. No stations closed. Everybody is facing staffing shortages because of this virus. I don't know how many times we have to say that. And no person, no union person or anybody else should take advantage of this virus for their own political agenda. So that's as much I have to say there.
Okay, just tying into the staffing shortages in the event of this storm becoming major, how do you see the response when it's supposed to be all hands on deck, but we're already short?
We will be ready. We have had people, for example, who have died in public works. Public Works as a department will be ready. We have had people, for example, person who has died in solid waste, and a number of employees who have tested positive. But solid waste continues to function. Same thing with police, same thing with fire. I have 21,000 employees in the city of Houston, and they show up. There are many who are working remotely, but whether there's a virus or a storm, they step up and they get their jobs done. And I want to thank them. And quite frankly, for most of them, they're not complaining. They are simply committed, dedicated, and they're doing their job. And so I don't want some union boss to color the dedication and commitment of firefighters, police officers, and municipal employees.
You have to leave it there. Thank you.
Thank you so much.
Thank you.
Mayor Turner, having this board schedule, my dad worked with you in the House of Representatives, and he would kill me if I didn't say hello. Swallows. Do you remember Curtis Swallows? Yes, no, my dad, and he would be so mad if I didn't tell him. So many good things about you.
Tell us about it.